All right, today we're talking about a medication called Empagliflozin. You probably know it by its brand name, Jardiance. Now, this drug was originally made for one thing, treating diabetes. But wow, did its story take a turn. It turns out it does way more, and it's completely changed how we think about protecting our heart and our kidneys.
So yeah, let's just get right into it. This is way more than just a diabetes drug. I mean, it started there, sure, but it has totally blown past that initial purpose. We're now talking about a powerhouse for protecting both the heart and the kidneys. And how we got from point A to point B, well, that's a really fascinating story.
Okay, so here's how we're going to break it all down. First, we'll look at the drug's evolving identity. Then, we'll get into how the body recycles sugar, which is super interesting. After that, we'll see how this drug flips a switch on that whole process. Then we'll cover the widespread ripple effects, and of course finish up with the risks and the really important rules to know.
All right, Section 1, a drug's evolving identity. We're talking about its journey from simple glucose control to this incredible cardiorenal protection. Empagliflozin's story is just a classic example of scientific discovery, right? You create something for one specific job, and then you realize, wait a minute, it can do so much more than we ever thought possible.
So, what exactly is this stuff? Empagliflozin belongs to a class of drugs called SGLT2 inhibitors, and that name is the key to everything. See, a lot of diabetes meds work on insulin, but not this one. Its whole operation is based in the kidneys. Its one fundamental job is to help your body get rid of extra sugar by, well, peeing it out. It's a totally different approach.
Now, to really get how this drug pulls that off, we have to take a quick step back and look at what your kidneys are normally up to. It's all about something we can think of as the body's own sugar recycling system. And the star of this show? It's a little protein called the SGLT2 receptor. The best way to picture these guys as tiny, super efficient sugar recycling centers located in your kidneys. Their entire mission in life is to make sure no sugar gets wasted. They grab glucose that's been filtered out and send it right back into your bloodstream for energy. So here's how it works step by step. First, your kidneys are constantly filtering your blood. As they do that, these SGL2 receptors, our little recycling centers, grab onto the sugar, and finally they return that sugar to your body to be used as fuel. It's an amazing, super efficient system. The problem is, in type 2 diabetes, this system works a little too well. It becomes overactive, pulling way too much sugar back into the blood when it should be getting rid of it.
And that brings us to the main event, Section 3, flipping the kidneys switch. This is where empagliflozin comes onto the scene and just completely rewrites the rules by interrupting that whole recycling process.
Okay, this right here is the heart of it. On the left, you've got the without picture. Those SGL2 receptors are working overtime, grabbing all that sugar and throwing it back into the blood. But on the right, with empagliflozin, bam! The drug blocks those receptors. It's literally like hanging a closed for business sign on the sugar recycling plant. The sugar can't get back in, so it's got only one exit, out through the urine. And that's why you'll often hear this mechanism described as unloading glucose from the body. It's a perfect description. You're just taking the excess sugar and getting it off the truck. And a cool little side effect of this is that water likes to follow sugar. So as you unload the glucose, you also unload a little extra fluid, which gives it a mild diuretic effect.
Okay, so we've blocked the sugar. We're unloading glucose. The big question is, so what? What happens next? Well, this is where it gets really amazing. We're about to see the widespread ripple effect. This one single action kicks off a whole cascade of positive changes that go far beyond just lowering blood sugar. We can really group these benefits into 4 main categories. You've got the obvious one, glycemic control, but then you also get weight and blood pressure reduction, and then the 2 big ones, powerful protection for the heart and incredible protection for the kidneys.
For someone with type 2 diabetes, this is just a triple whammy of good news. First, it lowers your HbA1c, which is that key long-term measure of blood sugar. Second, it can help with weight loss, which makes perfect sense, right? You're literally peeing out sugar, which is calories. And third, it helps lower blood pressure. You put all 3 of those together, and you're dramatically reducing the stress on your entire system, especially the heart and kidneys.
But this is the discovery that turned the medical world on its head. This was the real game changer. Huge studies showed that this drug didn't just help with sugar, it massively reduced the risk of dying from cardiovascular problems and being hospitalized for heart failure. And here's the kicker, the part that shocked everyone, this worked even in people who didn't have diabetes at all. That was it. That was the paradigm shift that made this drug a go-to for protecting the heart and kidneys, period.
Okay, every powerful medication has another side to the story, and it's super important we talk about it. Let's get into the risks and the important rules you need to know. Because with any drug this effective, you have to understand the potential downsides and who it's absolutely not for.
So let's break down the side effects. The most common one, by far, is genitourinary yeast infections. And that's not surprising, really. If there's more sugar in the urine, it can create an environment where yeast can grow. The good news is, these are usually pretty manageable. Then you have some effects from losing a bit of extra fluid, like feeling dizzy. And finally, there's a very rare but very serious condition to be aware of called euglycemic ketoacidosis. Basically, it's a dangerous buildup of acid in your blood, and it's something doctors watch for very closely.
So who should absolutely not be taking this medication? Well, it's a no-go for patients with type 1 diabetes, mainly because of that increased risk of ketoacidosis we just talked about. Same goes for anyone with a history of a serious allergic reaction to it. Also, it's not for patients on dialysis or with really severe kidney problems, and it shouldn't be used during the second and third trimesters of pregnancy.
And this is some super practical, need-to-know stuff. They're often called sick day rules. Look, when you're sick, dehydrated, or getting ready for surgery, this medication can raise the risk of dehydration or ketoacidosis, so your doctor will likely tell you to pause it for a little while. The most important thing here is to talk to your doctor before you get sick and have a plan in place. Just know what to do. So that's the story of empagliflozin. It's a journey from a straightforward diabetes drug to a revolutionary force in protecting our heart and kidneys. And it really makes you wonder, right? It leaves us with this huge question. Is this the future? Are we looking at the beginning of a new era of preventative medicine for some of our most vital organs? It's a really exciting thought to end on.